Well, is there anything in your work, Marina, we'll start with you as you're closest to me, that you see as unmet need, that is something that's asked continually or something you're able to help address?
Yeah, I think fatigue is one of the biggest things that people talk about in brain tumours, and it's, to be quite honest, I mean, it's something that I'm not sure that we can fix, you know, and sometimes saying to people the questions, when they ask questions, that sometimes there's just some things that we haven't got any resolution to, you know, that we can't fix things. And fatigue sometimes is one of those things that I think fits into that. And I do, one of my biggest things, even when I meet people in hospital, is I say to them, get out and exercise, and that's all good and well, but I'm not even sure half the time I get the exercise myself. But yeah, so there's things around like that. I mean, the other big thing for me, in one of the other talks, somebody spoke about somebody who was 30, 40 or 50 who had become palliative, probably wasn't suitable for a palliative care, or was, you know, had been in long-term care where they weren't being able to be managed at home, and they ended up in a nursing home. And I mean, that's a big issue for all of us, because if you're 30 or 40 or 50, to put you in a nursing home is a horrible thing, because it's not the right environment, but we don't have anywhere else. And if you can't be looked after at home, and you know, you're too well for a palliative care facility at that time, there are no other options, you know. So that is a big area of an unmet need. But you know, for the patient group that we see, they tend to be younger. So that's an area. And the other big one for me is the around the behavioural, the cognitive changes that occur, and people getting support or getting understanding or getting the tools of how to better manage that, you know, or to improve their memory, or, you know, those sorts of things. And yeah, so they're the areas for me that I, as a nurse, find hard, where people ask me all the time and I don't have the answers, you know, for that. So that's frustrating for me. What about you?
No, I completely agree with you with what you've mentioned, and just basically because where I'm located at Liverpool, we do have a very high non-English speaking background, population of patients, and that seems to be one of the biggest areas, like where I am, where there seems to be ongoing problems there. I mean, in terms of information, trying to get information out to them. As you all know, you know, brain cancers aren't a very, very popular type of tumour to have, and not many people know about it. So trying to actually get specific information for specific treatment options on their type of tumour is pretty much slim to none. And it makes it quite difficult trying to get that information across. And as you know, you can use interpreters as much as you like, but a lot of that information is lost in translation, unfortunately. So, and only so much of that information is actually received by them, which makes it quite difficult. And often I'm dealing with families who literally don't speak a word of English, and it makes it really, really difficult, because they don't have anybody else to speak to that can call me and say, look, Wife, this is what's going on. You know, I remember one patient quite vividly, and when, you know, the wife would call me and she didn't speak a word of English, he didn't speak a word of English. They had a young, you know, child at home. He was obviously going through, you know, a lot of behaviour changes. And when the wife would call me to say that he's been vomiting overnight and he's got really, really bad headaches, I would know by her voice that it was her, so I'd have to call the interpreters, try and get a phone interpreter at that time to get her to call the patient's wife back, and then get the story from her as to what's going on. And there was one incident where I actually had to call an ambulance on their behalf because she didn't know how to call an ambulance. You know, so it makes it quite difficult when you're dealing with that population group. So, yeah, and I'll stop right here. Yeah.
So has anybody got any questions?
Yes.
Go for it.
In today's society of split families, how do you deal with split family dynamics, and especially when they go wrong, and especially when it regards a child for treatment?
Yeah. Look, I don't, in regard to the child that's got the brain tumour, I don't deal with children at all. I've got everything to do with, but I do get that. I mean, we get young adults and the parents may be divorced, and there's relationship changes between the parents, and they won't be talking. You know, and when the young adult ends up needing further assistance and going down the palliative care or supportive care bit, that's hard. You know, I mean, when you're trying to support this 20-year-old and the parents aren't even talking to each other. But yeah, I'm happy to say that I don't do anything with children.
Has any of those dynamics actually improved? Like even just with 20-something-year-olds, are there any policies in place or procedures in place that have actually improved your efficacy in that area with dealing with split families?
Yeah, look, you can only, I mean, it's all about open communication and trying to, you know, communicate with both parties if they're not talking to each other. And you really need to have an advocate for the patient and somebody that's a main go-to person, really. But yeah, I mean, it's a hard situation.
Sorry, I'm not sure if this is the right place to put this question, but I was wondering if there was any scope to provide some sort of booklet or information package to give to employers. I've had a lot of trouble with my employment around them understanding my situation, and as well as my employers, my colleagues also.
That's a really good suggestion. That is a very, very good
I mean,
suggestion.
I tend to refer the, you know, Cancer Council, because they've got written information and they actually have, pro bono legal advice and stuff like that. So I tend to push that back a little bit to the Cancer Council because they've got much more information than what I do. But the other area that I utilise a lot is the Commonwealth Rehab, what's it called? CRC? Yeah, CRS, yeah. So they're very good as well because it's not my area of knowledge, you know, and really your employer needs to know that you can do the work that you could do. But yeah, so I tend to use those two areas, but Cancer Council are excellent. They do have a lot in regard to legal information.
Are you talking about like a pamphlet specific to, like, targeted to employers in relation to patients who have actually been diagnosed and living with a brain tumour?
Yeah, I guess so. Like, I work for a fairly large corporation, and there's been a lot of not understanding, or them not understanding my situation to a full degree, and taking advantage of certain aspects, but still battling to get back to work. So
But they should support you in trying to get back. So have you been to your HR department and all of that business?
I've been
Fighting
to HR and just through my boss, boss's boss and boss's boss's boss and so on. They just haven't been very fully understanding of the situation, and I have been going through CRS as well. They've been a great support. But I just thought if there was some sort of information package that could be given to them, it would be grateful.
Can I ask your doctors, have they given them the information? Have they written letters in support of you and what you are capable of doing and what you aren't? Yeah.
Yep. No, they have done all of that. So
okay.
It's a very big organisation, and they sort of don't really care.
Oh.
I mean, I have heard of people that that the minute they get diagnosed with a brain tumour, they pretty much just let go from work, which I just cannot fathom. I actually had a friend who owned a company, and one of his employees got diagnosed with a brain tumour, and he sort of just let him go. And I said, you realise this person may, you know, go through some financial hardship, all the things. It's a bit of, you know, well, it's not my problem. So it's a hard one.
The difficulty I had was the bank underwent a number of restructures throughout the time that I've been off work. So I've gone through a different manager each time, sort of thing. So you have to explain the situation again and again and again.
I think a lot of the time big companies are trying to make sure that you're going to be able to do the work that you used to be able to do. So, I mean, even if I get phone calls where employees are giving you a hard time, maybe they suggest that you do neurocognitive testing and things like that to actually prove that you can do the work, or retraining, which CRC are very good at as well.
Yeah, no, thank you.
But it does sound like some information for employers would be really useful. Yeah.
Extending, just extending on that, that could also apply to schools. Yeah, because I've had lots of meetings with a principal of a private school, but they don't give the right information to the teaching staff, and they've asked my daughter exactly what is your disability, because they can't see it. They can't see that she's had her head cut in half, basically. But,
I think the
they
difficulty
don't get
though
it.
is, depending on where your brain tumour is, you may have different things going on, so it's a bit hard to do a one-off pamphlet that's going to cover everybody, because not everybody's the same.
Yeah, I guess
You know,
that could
that's
be.
the hard bit.
The American Brain Tumour Association has pamphlets for employers and returning to work, and also for your child returning to school.
Maybe it's something we can look at as a group down the track.
Well, people look at you and you say there's nothing wrong with you.
Yeah, yeah.
You should be well now, 12 months since your operation. My question is, sorry, can you get to the mic? Oh, sorry. Then it gets on the tape. My question is, I don't know it's appropriate, is insomnia. I get 2 hours sleep most nights. My dentist, who had a brain tumour out 10 years ago, still only gets 2 hours sleep a night. Is there anything besides relaxation music, or walking the floor, or watching television, or doing something to
Well, again, exercise.
Doesn't
you know.
help.
So any of those sorts of things. Obviously, if you're going to steer away from medication, acupuncture, I think, music therapy, even reflexology, mindfulness. I mean, even if I've got loads going on at work and my mind's going at 2 o'clock in the morning, I actually get up and I've got an app that's pretty much puts me back to sleep pretty quickly. So I think all of it, so when you've got a lot of things going on in your mind and you're wondering about your future and there's millions of questions running around in your head, people do have problems sleeping. So yeah, I suppose it's a matter of trying lots and lots of different things. Yeah.
Yeah, I think that's probably there are no easy answers to that. I think, you know, the things you've said, it's about trying and seeing if any of them can work for you.
Have you had a go at any of the acupuncture or reflexology or massages?
Relaxation music and different other things, and getting up and exercising and everything out, and Pilates, but it doesn't work. I mean, you know.
Do you sleep during the day?
Everything else, you know, but 2 hours, 3 if I'm lucky.
Yeah.
I can't read at the moment because my eyes are still a bit sore and that, but, you know, you like a bit of sleep. When he told me the other day that 10 years since his tumour out, he still only gets 3 hours of sleep, I thought, thank you very much. So he's tried everything. So you reckon that acupuncture is quite good too?
Yep.
Try that.
Just following on from that comment, I'm a clinical psychologist, and lots of people who I see really suffer from sleep difficulties going through the cancer journey, from insomnia, which is early onset difficulties with getting to sleep, to midnight awakenings, and trouble getting to sleep after that as well. But there's lots of really good therapies out there that clinical psychologists have, including sleep hygiene and cognitive behavioural therapy, that may be effective for your situation. So my suggestion is perhaps check that avenue out, as well as, you know, if you want to pursue complementary therapies like acupuncture or naturopathy or something else, that's great. But certainly that is something that I see commonly in my clinic anyway.
I have had problems myself. I think I had my last surgery in 2012, but each time I travel by air, I suffer from bouts of headaches while it's still up before I land, and those headaches, they would last for 3 to 4 days. Yet prior to that, I'll be feeling quite well. I'm not sure whether this is a common phenomenon for people who have had brain surgery, or if we heard other people talk about the same problem.
Okay, what have you
go
got?
for it.
I mean, I don't know what type of tumour you got, but if anybody comes into any of our clinics and they've had surgery or radiation, obviously the risk of swelling, because your head's a closed box, you know, you're going to potentially get headaches. So if you go onto an aircraft and it's got a cabin pressure, and you're going, depending how high you're going up, you're going to increase the pressure in your head. So it can be common that you're going to get headaches after a flight, which lasts a few days. Sometimes what we do, if we know that somebody's got a fair bit of swelling on their scan and they're going to go on a flight, is we actually give them a couple of milligrams of dexamethasone to counteract the swelling before the flight. You know, so, yeah. It's just all to do with the cabin pressure, I think. But one of the doctors here could probably answer that question way better than me.
Hello, I've had 2 surgeries since 2004, and I'm on about, I think it's 3,500 milligrams of Keppra. So I get really tired, and exercising, because whenever I went to exercise I was having seizures, so basically I was having a seizure every month. So it's just frustrating because I can't, I feel a bit intimidated when I go to exercise, because as soon as I push myself, then I start to have a seizure. So I've taken to cooking, which means I take to eating, which means I'm putting on weight. So I suppose I'm just, I don't know, I don't think anybody can resolve it. I think I just have to eat less and just not focus on worrying about exercise. I'm just sort of saying it out loud.
But what about Pilates and yoga and stuff?
I did yoga, but when I bend down, I might lose my balance. I did yoga for probably 12 years before, and I was doing yoga before the right up to the first surgery, and just before the second surgery, I just couldn't do it.
What about something as gentle as walking?
I walk. And I've got a very old dog, so I walk gently. But I don't think I'm really getting, I need to get my heart rate up. But as soon as I get my heart rate up, it's almost like anxiety. It's very strange. It is, but it isn't
Not
anxiety.
necessarily though. Walking's a great thing that most people, I should take example, like, you know, I'm talking about it, but no, really. But walking's one of those exercises. It's very, very gentle, and providing that, I suppose, you're eating sensibly and everything else is maintained in your life, you will shed the weight. It's just a case of, you know, it's probably going to take you a little bit longer, but you will get there.
It's just interesting the number of people that have similar complaints with fatigue.
Yeah.
And yeah, I definitely, like, fatigue's a huge one with me, and anybody, because I'm with the cancer support group, the telephone group, and it's all of us have really bad fatigue.
But if you do enjoy yoga, I just thought I'd mention you can find, it takes a bit of looking, but you can find yoga classes that you do actually sitting in a chair. So if balance is an issue, it could be worth looking for one of those specialist classes, just if you enjoy it, you know. Yeah.
And see if you can link into, there's neuro-specific physios and stuff,
Okay.
you know, that will give you exercises for somebody that's got neurological condition.
Okay, that'd be great. And a head massage too.
Yeah.
I've just looked at the time and we pretty well need to wrap up. So is there any other last burning question?
Can I just very briefly, from observing what's happening here, there is so many people who have so many questions, and there is not one question that addresses everyone's needs, obviously. Coming back to unmet needs of people who are affected by brain cancer or their families, one thing that I have discovered for our family, and we have a little boy that has been affected by brain cancer, is that we have very little time to just be, because we have to organize so many things. I don't know how many questionnaires, how many application forms we have completed. How many hours have we spent on the internet to trace information that give us the answers to the questions we have? And then we found the information, and then we got to sit down and digest it and interpret it and work out what does it mean for me. How many hours have we spent just talking to Centrelink? How many hours of that was waiting on the phone? So from my perspective, one of the biggest needs that we have as a family is someone who we can ask, can you just please do that for us? Ideally, someone who I can ask, can you please call Centrelink, and once you're talking to a real person, hand me over the receiver. Or someone who you can ask, you know, are we getting the appropriate benefits from Centrelink? Yeah. You need to be a highly trained accountant or lawyer in order to work out whether Centrelink is doing the right thing by you. We coincidentally found a few things where they've done things wrong. And that was by coincidence, and that's because we're very diligent people. In that time, we could have given so much love and care to our son. Yeah. So my suggestion is, you know, can a scheme be set up for people who are affected by brain cancer, where you have a single person who you can build up trust with, who you can delegate these menial tasks to, so you can look after your family. And I think that's, you know, that would be the biggest help for us.
I'm really, really sorry hearing that you are actually experiencing that. Look, that's generally what me and Marina and Alana down there, that's generally what we do for our patients. So I'm not sure where you're from, but I would, sorry.
We've been with one of the hospitals, and we have been given, I think a counsellor was her title, allocated to us, whose role was to do all this. She was about very, very nice person, about 22 years old, you know, very inexperienced, didn't have children herself. It just, while she was trying really hard, it was just not a person who you would take advice from, or who we would be prepared to advise. And I don't want to sound arrogant here or anything, but you know, it takes some maturity, some life experience to empathize with those people who are going through this. And we had caseworkers with, you know, various support agencies, and you know, these caseworkers, they change like we change underwear. You know, it just, one day it's this person, one day it's that person, and you start telling your story again and again. So we would be looking for someone consistent, someone mature, someone reliable, and someone who can not be sympathetic but empathetic. You know, who can say, yeah, you know, I can see what you need, and someone who says, yeah, just give the form to me, I complete it for you, and you just sign on the dotted line.
Girls, I guess that's something to take on board and look at some sort of solution.
I just wanted to second everything that gentleman said. Yes,
Maybe you could be our, because it sounds like you actually need a care coordinator, one consistent person.
You do, yeah.
Who's going to help you out. I mean, I can't say that I can fight with Centrelink for you, but you know, to some degree with the Centrelink forms, it's about filling them out in the right way. And I was saying to a patient earlier today, Centrelink don't know anything about your condition. It's about the boxes that are ticked, and they haven't got a clue about anything else. So, you know, sometimes I say to my patients, ignore what's on this form, because it's what Centrelink will want to see. And it's going to, you know, lessen the burden for you. But
still, it takes you a long time to complete
this. Yeah.
I think they send reels of forms to put us off.
Yeah,
yeah. That's why they don't accept emails too.
Yeah,
Mm.
so it just becomes too overwhelming and we walk away.
Yeah,
Look,
the
generally
other
with-
things, well, Centrelink do have social workers who are supposed to be there to assist you in completing the forms as well. So, you know, the thing is you end up getting angry and, you know, you end up getting upset because you're talking to multiple people from the same, you know, area.
Generally, with all my patients, I do refer them, particularly the more needy, whether they be the benign or the malignant group, but the more complex ones I automatically refer to social work. And I'm very fortunate in that that we work really well with a fantastic social worker, and she generally says, you know, she has a look at the whole situation. She'll actually meet with the family and sit there and discuss and say, right, well, this is what you'd be entitled to, because obviously that's part of her role. So she'll actually update the family and she'll say, okay, then you'll need to fill in this form, or you'll need to speak to this person, and she'll actually follow things up, you know. So I'm not sure if you do have experienced social workers where you are, that you can actually tap into and maybe have a bit of a chat to them.
Well, we had some, but as I said, they keep changing. You start telling your story again, and you know, you end up talking to someone who you don't know, someone who does their job but who doesn't know really much about it.
Okay, all right.
And at the time, just as I said, the hours we spent on the internet finding information, it'd be really nice to be able to say to someone, we need some information about blah, blah, blah. And then they can do all the research for you and come back and say, here it is.
On that note, I think we may have to end, and I'm not being dismissive of the very important points that you two in particular have raised, because in my professional role, that's a job I undertake, and I've been undertaking it for 20 years. So if you wouldn't mind joining in thanking our panel.